Have you heard about the latest study on tracheal cartilaginous sleeve in infants with midface hypoplasia?
You mean where they linked TCS with Behr-Stevenson syndrome?
Exactly. It's pretty fascinating because TCS, which is when the tracheal rings are fused into a continuous cartilage, was previously mostly reported with Cruzon and Pfeiffer syndromes.
That's interesting. So finding it in Behr-Stevenson syndrome broadens the scope, huh?
Definitely. And what's more, performing tracheostomies in these patients is quite challenging. The fused trachea lacks normal landmarks, so surgeons can't rely on standard techniques.
I can imagine that makes things tricky. How did they manage it?
Well, they used bronchoscopy and needle localization to find the correct spot for the tracheostomy.
Right.
It's like trying to find a needle in a haystack, but with a bit more precision.
Haha, that's a good analogy. But wouldn't preoperative imaging help identify these issues?
You'd think so, but sometimes TCS isn't apparent even with imaging or bronchoscopy.
Really?
It often only becomes clear during surgery.
That's surprising. Do you think surgeons should always be prepared for TCS in these cases?
Absolutely. Anytime they're operating on infants with midface hypoplasia from craniosynostosis syndromes, they should anticipate encountering TCS.
But isn't relying on intraoperative discovery a bit reactive? Maybe we need better diagnostic methods.
True, but until then, being prepared during surgery is crucial.
I suppose.
It's about managing what we can control.
Fair enough. So did they mention any other challenges?
Yes, the trachea is often shorter, so they needed custom-length tracheostomy tubes.
Oh, right.
Standard tubes could be too long and cause complications.
That's an important consideration. It's amazing how these details make such a difference.
Exactly. It's all about tailoring the approach to the patient's unique anatomy, which is why awareness is so important.
Definitely. This really highlights the need for specialized care in these rare conditions.
Couldn't agree more. And, the study emphasizes that preparation can improve outcomes significantly.
Absolutely.
It's encouraging to see progress in this area.
Indeed. Hopefully, with more awareness, we can reduce the risks associated with these surgeries.
That's the goal. Better understanding leads to better care. It's all
Exactly.
interconnected.